Break. You gotta break it back.
I hold this one.
Okay, we're going to stand you up, huh?
Hang on. He's not wearing. He's not wearing non-slip shoes.
And I'm gonna put this away. Okay.
Okay, let's
Hang
go.
on, hang on, hang on.
Okay,
Alright.
I'm gonna put this away. Aggie will hold the back.
Alright. You ready?
Okay, ready?
Ready?
1,
2, 3, up. Okay.
Come on, walk, David.
Step back, baby. Come on,
Okay.
That's
That's why dapat. So why that's why it's so.
I said that. Use the voice.
We need to use the voice, Mommy.
We need to use the horse because it's high. It's okay, David. It's alright.
What?
It's okay. We just only try the bed. I'm holding the hand.
You hold the I'm alright with this one.
It's okay, David. It's alright.
You know the horse with the one you use to transfer.
Do you have standing horse here?
Yeah,
Yeah,
the voice.
standing horse, but
He's standing, but the bed is very
But we
high.
get the lifter,
Yeah.
so we can use that one.
Yeah.
okay, you try, David, and then
Because
okay.
standing up with that height.
And there's a reason for that, which I'll explain.
You want to show us the control if we want to. Okay, David, you like try that? It's new one.
Yeah.
David, look at me. Try and relax. Alright, this is all new, but it's all there to help you. So what we want you to do is lie down. Okay? You're worried about your socks.
Oh, he just always has
Yeah.
some,
Alright,
something that he
so-
gets fixated with.
Yeah. Okay.
Alright.
David, okay.
Okay, just listen.
Now,
So
Just
we
listen. Just listen and you.
what we're going to
Yeah,
get
put this one
David
down.
to do, can we get David to lie down in the actual bed itself?
yeah, if we put this one down, we use a slide sheet. You go to that one.
Yeah. So you have a second control here,
Ah, there you go.
which lowers the size down individually.
That's good.
You want to get the slide sheet.
Yeah, wait, it's ready.
You lie down. Lie down, David. Come on, David.
Stick that one there.
Come on, you lie down.
It won't take
Oh,
long.
sheet.
Come on, David. Come on.
Because there's no
You lie
sheet
down
at the
and then
bottom.
we push you into the other side, okay? Come on,
We'll
David.
use 2 of these ones.
Okay. Come on, you lie down a little bit. That's it. That's all.
There you go.
Yeah,
Now,
that's only one.
roll over to my side.
Where?
Okay, it's okay. It won't take long.
Now, you can roll him this way so you get access. That's better. Doing well.
Oh,
shaking.
I thought you were holding the one.
Okay.
Okay.
You right there? I'm gonna pull him a bit on this
One.
side, okay? 1, 2, 3. Good.
Yay!
Well done.
Okay.
Alrighty.
Alright,
So,
a bit more, a bit more. A bit more. Near the center.
It's alright. It's alright.
Alright.
She doesn't want that.
so
Okay,
what we're
okay.
going to do now, David, we're going to raise these sides up so that you can't fall out of the bed, and that's what we don't want you to, because you're going to hurt
It's
yourself.
alright.
Now, there's a button. Now, just try this. We're going to get David into a nice comfortable position. All change. There you go. Lie back, David. Lie back, mate. You lie back.
Because he's always driving.
I know.
Here we go.
Okay, it's okay. It won't take long. Okay, David.
Oh
All
wow.
very new.
Very nicely.
Yeah, it's okay. Look how soft it is.
We've got to get you to try and relax. What we're trying to achieve, and to be honest, it's the first time I've seen anybody with Huntington's get into a bed without, sorry, it's confronting for me also, so I'm going to say that.
Okay.
So, what we're trying to achieve with Huntington's, the movement, what they call career movement, tends to force them one way or the other, okay? What we proved through trials, especially through the Wesley mission in Victoria, is that we can position David that he's in a valley. So regardless of how severe his movement is, and he's not got overly excessive movement at the moment, but if you can keep him in that valley, it means he's not going to be able to move up or down. In other words, he's safe. It's secure.
Yeah, okay.
Part of David's issues as things progress is that fear that they're going to hurt themselves. So finding that nice comfortable spot in the middle, where perhaps it's not quite as high in the back, because we've got to get him to lie down a little bit, and we will get him to relax each time. This is early in David's journey. It's generally, as a rule, these beds are delivered much further down the line, and you know, there's a massive need for them. And I think David obviously hasn't got to that point. So when you're getting him into bed, if you can get the carers to position him where he can't slide one way or the other, you'll do yourself a lot of favours. What's more, once he gets used to the bed, he'll be fine. He'll be able to watch his TV. He knows that if the movements do come to the point where it's quite severe and his heels come down or his arms come down onto the bed, he's not protected. From your point of view, not having manual sides makes a huge difference, because they're all automated. It means that you're not having to pick them up. And the original Huntington's bed, you have to pick these up, swing them down, pick them back up and do it again, and it becomes a little bit occupational health and safety doesn't work like that. Now, one of the things I noticed you guys were talking about, you alright mate? One of the things you were talking about earlier was that why is there a lip above the mattress? Yeah, it sits above the mattress for one simple reason, is that when the condition progresses to the career movement becomes quite advanced, and there's a flailing leg or an arm comes flying out and catches somebody where it shouldn't do, it is to protect the carer as much as anything else. David at the moment obviously is a manual transfer, and that may be an issue. So what I've spoke to Tracy about is that we'll make a new mattress this week that's a little bit deeper, that you can, it won't be deep itself, it's going to be about 3 or 4 inches, sitting underneath the existing mattress. This will raise this mattress up so that this isn't as big a gap. Once the big condition progresses where you feel you need protecting as carers, take the other one out, do what you will with it, but at least then you're not going to have to struggle. But I will say one thing, I don't think it's far away from being a hoist transfer. I do say that in all due respect to everybody, because someone's going to get hurt. He's comfortable, he's safe, and that's your paramount concern. Alright? Yeah, exactly. And you know, you do research on conditions like Huntington's, and you'll see that everybody has different sets and different movements, and you'll generally find that as the disease progresses, that as the movements do become more advanced, you know, you've got to think of yourselves, also keeping David in mind. So this is why this is here. How this simply works, this is a simple set of controls. Back up, back down, leg up, leg down. That does both the back and the legs at the same time. Sorry mate, you're my little crash test dummy, so I'm letting you do all the practicing, alright? This is your high-low function. Now, one of the things I will say is that, and I see this all the time, is that some of the carers, they take it to its high-low position. Now, they presume, because obviously David's got nice padding size that he can't get out, but what if that 1% chance he does try and get out? And if the high-low is still up, I'm not saying you guys would ever do it, but I've seen in other places it does happen. Now, one of the issues with the bed in terms of how you look after it, this is called a wall hugging bed. So the high-low will come up parallel with the wall and then pull away from the wall at the last minute. It does that to protect things that are normally fixed to So, one of the dangers of this is that the high-low's up, the carers push it into the wall, they bring it down again, and then we have issues about pulling plugs and lines out. So what I recommend you do on Monday, and Tracy's videoing this so we can actually, you know, get the maintenance men. Get the maintenance men to get a hard piece of foam or something similar. Position it behind the wheels so it cannot go any further than what is necessary. Alright? Simple. Now I'd like to say that was my idea, but it wasn't. It was a lovely lady down in Victoria who gave me the idea. So also at the end of the day, you're going to protect the bed. So that you guys work with them every day of the week. So there's no lecture about that. On the side features, you've simply got 3 sets of controls. This will move this one up and down. This one will move that one up and down. And this one will move them both simultaneously. I don't know. Alright?
In the middle.
Yeah.
Both sides.
So
And then
it
the
basically
other one is-
means then that you're in charge. You've got options. There's a place in Townsville that at one point where it was taking 4, like yourself, it was taking 4 carers and nurses to get a client into bed, and now it's down to a 2-person transfer because they use the hoist. One is in charge of the hoist and positioning and so forth, and the other's in charge of manoeuvring the sides. Again, I think it ticks a lot of boxes in the sense that it's very friendly for you guys, but even more so, it's going to save David from getting bruises and cuts and bones and things like that. So, and that's what it's about, detection. Any questions?
So that's the lowest it can.
Yeah,
that's
lower,
lowest it can
that's
go, yeah.
the low.
So it looks like it's high because the sides are quite high.
Yeah.
You've got to remember these are not designed to do anything else but protect them. Yeah. And we've tried it at different heights, we've tried it at different widths, and so we've been doing this for 4.5 years, or just nearly 4.5 years, and ultimately we've made mistakes, but the team of people we work with on this, they work with Huntington's clients 24/7. So it's through them that by not having that lip above the mattress, one lady went in one day, a leg came across and hit her straight in the middle of the stomach. So why don't we try a little bit higher? There are downsides to it, as you can see. It does sit slightly above the mattress, but you can't have everything there. And I think paramount is everybody's safety.
But it doesn't really matter if we use the hoist.
Absolutely.
I was telling you a while ago, we got to use the hoist.
Well, look, the worst case scenario, I think, from my perspective, I'd honestly be considering a standing hoist at the moment. It's less confronting. It's certainly from your perspective, it means that all you're basically doing is getting into stand using the hoist. You can position them and sit him onto the edge of this.
We try to see the standing hoist if it's too high. We use
Yeah.
the hoist here.
Yeah.
Because it's that.
Have you got standing hoists here at the moment?
Yeah.
All right. I think you're the professionals. I'm certainly not, but I think it's that trial and error, and as a team, you'll make the decision that best suits, and whatever way suits is the best way.
Because we know he resists still the hoist.
He'll resist anything now. I know he will.
He
You can
resists the
see.
hoist, like now, yeah.
But the problem with the standing hoist, if he
He's
might not
holding again.
follow the instructions, he might move his leg
Moving,
up.
Yeah, out of
yeah.
that footrest,
It's like
that's
so.
that's
The only option we get.
It is, and again, you guys have seen him, and I've seen how
Yeah.
mischievous he is at the moment. So,
So either way,
but either way, you're gonna have
there's something
resistance.
Yeah.
You have resistance, and
Yeah.
but it's changed, and sometimes change is for the good. And I mean, look how relaxed he is at the moment. We put the TV on now, and he started watching the Bulldogs. He'd be even happier. So, yeah.
You got a new bed.
So what I'm going to do, I'll organise the new mattress on Monday. It's probably going to be about, what do you reckon, 12 centimetres deep. Place it underneath. It'll raise that up in its entirety. So yeah.
So how is this be serviced?
To be honest,